I'm going to share my screen. There's a share my screen option. Emma, if you can, oh, never mind. Sorry, I've seen it. That was me just being me. I'm not seeing it visually. Then let me make this a slideshow. So hi everyone. My name is Philippa. I'll do a little intro after, and welcome to the Pennine Area conference online. Thank you guys for taking your time out today to be here with me. To be able to learn and take away some knowledge today. I'm also here with Emma, who's helping me out set out. She's also part of the BPSA. I'll let Emma do like an intro about herself after I've done mine. So yeah, the Pennine Area Spring Conference, and we're going to be talking about innovations in respiratory health and pharma advances. So just come. I know I can't see your faces, but I know I'm pretty sure you're smiling behind the camera. And come and just be engaging. Feel free to use the chat box or unmute when you're required to speak, and we can do this together. And hopefully, we'll be able. I try my best to be able to finish. We'll finish earlier than 4, so just to give back some time to you guys as well. So yeah. So yeah, as I said, get comfortable. Ooh, not it breaking the ice before I do. Okay, so get comfortable and get involved. Like I said, ask plenty of questions and ignore the camera option because you guys can't put your cameras on. And also, I'll be giving out attendance certificates at the end of this. I'll try to do them actually next week. And also, yeah, like I said, the meeting is going to be recorded, and feel free to share, tag, do your thing. And also, if you want to stay behind at the end, you can stay behind for a chat. We can chat and just talk about, pharmacy and just get to know me a little bit more, and also like network with other people as well. Um, so yeah. So about me, my name is Philippa Kasaga. Basically, I study pharmacy. I'm a first year pharmacy student at the University of Bradford, and I'm the current Pennine Area Coordinator. And interesting facts about me. So basically, if you guys don't already know, I'm Ugandan. I'm from Uganda. It explains the wristband and my wrist. This is my identity. It doesn't come off. So I also like to play badminton in my free time because I used to play badminton a lot, like when I was younger. And then also I love reading my Bible in my free time as well and going to church. And also I love spending time with family as well and spending time with friends. So that's just a little bit about me, the things that I love doing. So yeah, and just to know a little bit about me, I'll let Emma introduce herself for the meantime.
Hi everyone, my name is Emma and I'm the current BPSA Vice President. I'm a newly qualified pharmacist. I was the competitions coordinator for the BPSA last year. Interesting fact about me, I love baking. I'm obsessed with making cakes and BPSA team know about that.
Who makes the best cakes, guys? I can vouch for her every day, Monday to Sunday. I can vouch for Emma's cake. But yeah, that's a little bit about us. Emma won't be here the whole time. She's just here to help me out with setup and stuff and ensure that it's going well. But yeah, the objectives of our conference. So basically, these are some of our policies as the BPSA. So we believe this association should be made aware of more opportunities that lead to non-traditional career paths. We also believe that we should encourage further investigations into healthcare inequalities within the UK population. And that's why we put on, conferences like this. Like, if you guys know, like, for example, a conference like this could be one of these things, dive into healthcare and, how us as BPSA and students, future pharmacists, we can help, make healthcare better. And also, if you guys look within, there's so many things in the BPSA that we do basically as students that we put on so many webinars and stuff. So you guys like have a look more into that aspect. And we also believe that prescriptions should be free of charge, of course. Okay, so just a little itinerary of the day, how the day is going to go. So we are doing basically registration and introduction management, which is like around this time. And then I'm starting the introduction of speakers. I'll be going into a little bit more detail, speakers and stuff like that. And just you'll see how the speakers look like. But from 11:30 to 12:10, we have Dosh, and he's a clinical Dirash. He's a clinical pharmacist. We also have Shemza, who's going to be talking about IPSF, and she's a trainee pharmacist as well. So from 12:20 to 1:30, so around 40 minutes, I'll let you guys go for lunch or have lunch. And then from 1:30 to 2, we have Deval. He's basically the market manager at Tryon Pharma, and he'll be talking about asthma treatments and stuff like that. And he has some samples as well for to demonstrate like the things that you attach to the inhalers. And then from 2 to 2:30, we have another clinical pharmacist who's going to be coming in to talk as well. And then from 2:30 to 2:45, we have competitions within the BPSA. I'll talk more about that when it comes to the time of talking about competitions. And then from 2:45 to 2:50, I'll talk about AC. I think you guys know a little bit about AC. I'll talk a little bit more about that. And then from 2:50 to 3, we'll close. So basically, we'll finish an hour earlier, which is always good. He doesn't want a little bit of free time back. So, and if you guys have any questions, feel free to ask questions. So if you want to take a picture, just to keep it on your phone of how the day is going to go like, just not to forget the times or anything, or the times that, have to come back from break, feel free to take a picture in the meantime. So, yeah, I'll leave it there for like a few seconds. So just take a picture and just have it on your phone, and also have like the people who are going to come and speak. So, so for the Pennine area, why did I pick the whole topic of respiratory, and why did I pick innovations in respiratory slash pharma advances? So basically it's out of actually it's a few reasons. There's one, two, three, four, five reasons that I chose it that will help to why we chose the topic. So basically, reason number one is out of personal interest, like in respiratory health, because I always see so many people, so many cases, even when we go on placement, people who suffer with respiratory issues, and what's it called? I'm just like, oh, okay. So one day in the future, how am I able to help these people when I qualify? And it's just so fascinating the different types of treatments that are available for these people, the medications that they go on. I found it so interesting. So that's why one of the reasons that I selected this topic. And what's it called? Also, I got inspiration from my reps and liaisons. So basically, we have reps and liaisons in the Pennine area. So I spoke to them and then asked them, can you guys help me pick out a topic? And they also they were thinking respiratory, they're thinking along the lines of respiratory, and partially for similar reasons, and also out of personal connections. So obviously I have some family members who have history of asthma. So asthma, like they get wheeze sometimes, they wheeze a lot. So it's just like when I again it comes to when I actually qualify, I can go into the respiratory to see how I can support them better handling their asthma. and stuff like that, and they have any breathing like problems, to be able to change, change the way they receive their healthcare and just make it a little bit more easier for them. And also out of global significance, so as we all know that respiratory conditions are basically one of the most leading cause of death, like COPD, all of these lung cancer, like all of the respiratory conditions. And despite of these conditions, there's not that much research that goes out into it, and it requires a lot of research, a lot of time, a lot of money, like charities to be able to fund all of this research. And there's not that many, and yet this is one of the leading causes of death, worldwide. And also, like as I said, the impact on global on public health is important because obviously as people every single day, people belong to families. These people are somebody's mom, somebody's child, somebody's dad. So they matter too, and they need attention when it comes to that aspect. Okay, so again, this is just a little bit more on why I chose respiratory conditions, like as I said, or why respiratory health is important. Conditions like asthma, chronic obstructive pulmonary disease, they infect when once you get infected with, a disease like that, it can change your life like forever, and it's just like there's no going back. But when you have supportive healthcare professionals, or if your family, when they're educated enough, they know how to support you when it comes to giving you medications, when it comes to being there for you, they're able to support you in that aspect. And also, yeah, just around those points that I've been speaking about. And again, it's just like raising awareness. This conference is also there to help to raise awareness, to bring light into the respiratory aspect. So I hope you guys enjoy it while you're here. So as I said, speakers. So we have Darash. Darash is going to be joining us shortly at past 11. So we have Darash, and he's a clinical pharmacist. We have Deval. He's the managing director at Triumph Pharma. And then we have Shamsa, who is also our BPSA IPSF officer. She's also a trainee pharmacist. And then we have Rahima as well, who is a clinical pharmacist, and she'll come later after our lunch break. So yeah, so I'm going to bear with me as I get the rush to join. In the meantime, as I said, feel free to use the chat option. If you have any questions, put it in the chat, and that way we are able to communicate with one another, or you can unmute yourself. Hi everybody, to the people who are joining. We are going to start shortly. Oh, sorry, we've already started. So I'm just trying to connect our first speaker to be able to come and join. Okay, I want to see if they're here. Okay, the rush has actually joined. So he has joined and he's in the room. So Darash, if you're ready to start, you can start. I'll just put this here, and he can make an introduction on himself.
Hi, Philippa. Nice to see you there. Can you hear me okay?
I can hear you okay.
Lovely to see you. Okay. So yeah, so my name is Darush, and I've been asked today by Philippa to talk to you about respiratory and pharmacy and my kind of journey as well. I'll put a few slides together. I'm basically a pharmacist. I've been a pharmacist for quite a long time, since I think it was 1996 I qualified, so it's quite a long time. As a pre-reg, I was in a Tesco pharmacy. It's actually one of the first supermarket pharmacies that opened at that time. and it was a nice experience. And even in those days, I started my interest in behavior change, because I remember somebody coming in asking for nicotine replacement therapy in those days to help themselves stop smoking, and they actually believed that it wasn't actually very effective, and it was mainly psychological, behavioral. So that sort of perked my interest up in, helping people with behavior change and high risk activity. So, but just to say, over the years, I've really passionate about pharmacy, and I'd say that respiratory, especially around that time, cessation was my sort of big area into respiratory. And then I eventually moved into areas like asthma and COPD and other lung conditions to help people with their lung conditions. So some of you, when you're starting your journey into pharmacy, you'll find that you can go in many different directions. And what I'll do is I can share some slides in a bit with regards to some of the tools and resources and reasons why I find respiratory is such a great area for you guys potentially in the future to get involved with. And pharmacists and pharmacy teams actually can get involved in many aspects of respiratory. So with my passion in this particular area, I'm finding actually people with poor lung health tend to be in areas in where pollution levels are quite high, and also where deprivation is quite high in the country. And the likelihood of a child, for example, starting smoking, for example, is quite high in a household where there's other smokers in the household too. And I know that with lung conditions, we find that it's really, lung conditions can really start from maternal smoking as well, So when we think about chronic obstructive pulmonary disease, some of us might think of it as a lung disease of older people, but we actually say it starts from maternal smoking potentially. So there's a lot of urgency in this country to help people, pregnant ladies, for example, stop smoking as well. So I've been involved with quite a lot of research. I started off in community pharmacy, didn't have a clue anything about research in those days, working in a community pharmacy, but I got involved with a team of people across Northwest London, where I'm based. And then we started to get involved in showcasing how community pharmacy can, for example, make a difference. I'm also a GP-based pharmacist, so I got involved in doing my independent prescribing course as well, and got involved in the COVID vaccination program as well during the pandemic, and was doing quite a lot with GP practices as well, which was really, really, really rewarding. Philippa, shall I start sharing some of my slides just to sort of give a bit of a flavour as well with some of the tools we've got in respiratory? Yeah. I'll start sharing my screen now. It just says I cannot start sharing while the other participant is sharing. So I'll wait for you to stop sharing, I guess, at this point. Perfect. Thanks, Philippa. You see my screen?
Yeah, I can see.
Lovely. Okay, so let me hide that panel there. And by the way, if there's any questions, Philippa, please, I don't mind being interrupted as well. So I think children and young people's asthma is an area that I've been involved in lately. And you think as pharmacists, we might think of working in the community pharmacy and being there all day working in the pharmacy. And that was my role for about 10 to 15 years. But then I started getting involved with running group consultations, for example, in the Chiswick Health Centre, which is opposite the pharmacy I was working for. And that was really rewarding. And to get involved in the National Centre for Smoking Cessation and Training. I had to do quite a lot of training and build up my skills in communication skills and getting involved in shared decision making, which are things you're going to learn. And you can do that for any kind of health condition or long-term health condition. But as I said, I was doing that a lot for respiratory over the years, starting off with treating tobacco dependence and then moving on to asthma in adults. And then you can see in the picture on the right, I was doing quite a lot of group consultations with children, young people, and their families. So it's really rewarding when you can see a patient empowered and able to understand more about their condition and manage their condition well. Over the years, I got involved with CPPE as well, Centre for Pharmacy Postgraduate Education, helping them build up their resources. As I said, the National Centre for Smoking Cessation and Training. So academia, education, real interest of mine, as well as doing clinical sessions like I'm doing in that picture on the right. And so pharmacy is really broad in that sense. We can go really in any direction we want to. Then nowadays, I'm part of the Primary Care Respiratory Society Executive Committee and chair of their conference organising committee, and also co-chair of the Task Force for Lung Health. And managing, being able to influence national policy in respiratory is an amazing feeling. And one of the things I'll never forget over the years I was doing respiratory, I was noticing we cannot take for granted people know how to use their inhalers, for example. People are on inhaled treatments and they make mistakes with those inhalers. And if you can't get the medicine to the lungs, then there's no point even prescribing that inhaler. So I helped develop something called rightbreathe.com. Can even have a look at that as well. That's got over 140 inhalers on there, and it's got inhaler technique videos. It's also got a lot of information about those inhaled treatments, because I found there was a gap. Myself and a couple of colleagues from the London Procurement Partnership found there were some gaps in knowledge when it came to knowing which inhalers to prescribe for children or for adults, which device is right, etc. So lung health is a big thing that we need to all think about. And I don't think any of us will take our lung health for granted now, especially during pandemic with viruses. And there's lots of other viruses, of course, going around, and the importance of getting ourselves vaccinating and also making sure that we keep our lung health as optimal as possible. Unfortunately, about at least 1 in 5 people will develop a lung condition during their lifetime, and that involves, especially during the winter time, our hospital beds, a lot of them are occupied by people with lung conditions. So we call it winter pressures, actually, when it comes to winter. And that's why as pharmacists, as a part of the multidisciplinary team, there's lots we can do. And I think one thing we've got to remember ultimately is, and you would have done this during your A-levels as well, during your degree, we need oxygen. We definitely need oxygen. And without our lungs, and if there's damage, and there's lots of things that can potentially cause damage. And as I say, it can start from maternal smoking or pollution. We had, unfortunately, a child who died of asthma due to air pollution. A young girl called Ella Kissy Deborah. This was the first reported death due to pollution. So we've got to think more holistically as pharmacists, not just about the drugs and the medicines. And that's what I love about our profession. We are doing a lot more where we can make do so much. And what I mean by so much in different settings as well. So, for example, in community pharmacy, as I say, where I started out, there's a lot of services that are paid for. They're remunerated, and they're all linked. A lot of them are linked to lung health. So, for example, we can help people with prescribing treatments if necessary, but a lot of it won't be prescribing treatment. It will be self-help. So community pharmacies, a lot of them, well, they all are all healthy living pharmacies, which is really good. And we can do things like asthma. There's World Asthma Day coming up. We have National No Smoking Day was in March. And there's going to be World COPD Day as well. There's Ask About Asthma Week, massive campaigns we can get involved with. But a lot of pharmacies these days are obviously offering vaccination services as well, which is great, and smoking cessation. There's the Big Pharmacy First scheme, so you can get involved in sore throat, sinusitis. So our clinical skills that we're picking up during our pharmacy degrees, a lot of it is going to be around long-term condition management and prevention as well, effective preventative medicine, which is great. And if you're working in a GP practice, which is really rewarding, a lot of the pharmacists are getting involved with asthma reviews. And these are normally 20-minute to 30-minute consultations. If you can run group consultations, that's even better because you can spend an hour with regards to upskilling and teaching and answering questions. There's also the whole thing around if a person has had an asthma attack or COPD exacerbation, we can do those post-review reviews as well after the attack and check that the patient is on their right road to recovery as well. And then if you're going down the hospital route as well, there's again, lots that can be done. A lot of patients, unfortunately, are readmitted to hospital with their lung conditions because they're not maybe using some of the non-pharmacological and pharmacological support. What I mean by non-pharmacological, for example, there's something with COPD patients that you can do around increasing activity. They may become inactive, and that means your muscles, like the diaphragm, etc., is not being strengthened as well as it could be, or the intercostal muscles, etc. So we need our lungs, precious lungs. I like to use visual tools like asthma airways. The airway models I've got. I have quite a lot of those around, and I distribute those to practices. Asthma and Lung UK, for example, talk about the lungs being like, they describe it like breathing through a hose pipe if you've got well-controlled asthma. And if your asthma is not well controlled, and I think around 3 children in every classroom will have asthma, then we're getting to a situation where you could be breathing through a straw with mucus in it. So you're exposed to those triggers, not taking, for example, regular anti-inflammatory treatment, and that will result in the person potentially going on to have an asthma exacerbation. And knowing where these medicines work and explaining how these medicines work is important. For example, the blue inhaler, a lot of you will be aware of, which is the short-acting beta-2 agonist, only works on the outside of the airways and it doesn't treat the underlying inflammation in the middle. So that sort of gives you an idea of how we can use tools and models like this to help upskill and educate patients. So this whole thing around empowerment, this is a picture with my colleagues from, at the time, it was Royal Pharmaceutical Society London Northwest Group. We're now called the Pharmacist Consortium London Northwest. But we've really got involved with a lot of respiratory campaigns to get a lot of more community pharmacies passionate about supporting patients, whether that's to become short-acting beta-2 agonist guardians, because there are quite a lot of patients overusing this treatment, the blue inhaler, or a lot of us will know about the overuse of antibiotics. So when it's appropriate to be used or given out during this pharmacy first scheme, for example, for sore throat, you don't normally give antibiotics for sore throat. So this is why reassuring patients around it's a self-limited condition is important, and how to best look after themselves, etc. There's also a lot around the environmental impact of if you've got good lung conditions, you're going to need less of your emergency inhaler, which is good news, and that's less impact on the environment too. So not only is good asthma control and good COPD control good for the patient, but it's also good for the healthcare system, because they'll be spending less money on prescribing drugs. It's also good in the sense you're going to have less hospital admissions. So that means less transport to the hospital, which is great news again for the environment and the patient. So this is the whole thing around becoming green agenda guardians and encouraging safe disposal of inhalers at the community pharmacy. So there's lots of things that we can get involved in with respiratory. We call this actually making every contact count as well, where you can, I, for example, walk into community pharmacies and I do some upskilling around what they can do in 30 seconds. We call it, you can do quite a lot in 30 seconds to help a person stop smoking. I'll talk to you about that in a moment, but also around awareness of over-reliance of this short-acting beta-2 agonist in asthma is a big problem because there's patients and clinicians as well who believe the blue inhaler is the main treatment you use for asthma when it's only meant to be used for emergency use only. In fact, one canister should last 6 months. It contains 200 puffs. And so we have lots of tools. Rather than me going through this in great detail, this is something I put together for my colleagues just to help understand why respiratory is quite broad and how from the bottom of this pyramid, what we need to think about when we try to support our patients is just to get a sense check of whether they have asthma, because it takes time to make a diagnosis of asthma. It's not easy to diagnose asthma, and there's no single test that will say, yes, you've got asthma. There's only, a lot of it's history taking, good listening skills, and then also you can use lung function tests and also something called FeNO, which measures your nitric oxide levels in your lungs, which is an indicator of inflammation. If you use these tools and you're getting a good history and the person's probability of asthma is increasing, then you can make that sort of firm diagnosis of asthma. Because if a person is misdiagnosed and they've been given a label of a condition they don't have, that's going to be a problem because you'll be treating them with the wrong treatment and you won't be treating the underlying issue. All of us here get breathless. So it's like, what is the cause of that breathlessness? What is the cause of that cough? Is there signs or indicators of wheeze in the lungs? Has that been recorded before? A lot of the tests might be done during times when the person's well, and it might indicate that actually that person doesn't have asthma if the tests are normal that day. But actually, we may have only caught them on the day that they're well. So this is why things like peak flow meters are useful. So can you see how with the right training, and there's a website called e-learning for health, you can go on to become tier 1, tier 2, tier 3 trained on asthma. Tier 3 is really good for GP-based pharmacist. So tier 2 might be good for the community-based pharmacist to get a real understanding of the condition. So as you go up the pyramid, you'll notice that every area across the country will have a local pathway or guideline that we would normally follow. And that includes not only inhalers, but it will include spacers as well that will be on local formularies. And there's also things like Right Breathe and Asthma and Lung UK. There's some patients being prescribed inhalers. They've been given the inhaler, but they can't use it correctly. It may mean that they end up, a prescriber might end up giving them a higher dose of the inhaled corticosteroid, which is the right treatment, but it's maybe the wrong strength because their inhaler technique wasn't checked properly. It may mean that they're being given a higher dose of steroid, which can potentially cause extra side effects. So these are the sort of things which the pharmacy teams will be looking at. But it needs to be with the patient as a partner in all of this, as part of shared decision making. We can use lots of visuals and metaphors as well. For example, to help patients get an understanding of what the difference between the brown inhaler and maybe the blue inhaler. For many years, as I say, people have been using the blue inhaler every day. It's not the everyday inhaler, the brown one is. So metaphors like this, imagine your house is leaking. What would you do? Would you use a bucket to get the water out, or would you call a plumber? The kids, for example, like these metaphors or these cards, and some of the kids will say, I would use a bucket. But if they can become their own plumber, and that is using their regular preventative treatment, then that can help, obviously fix the underlying problem, whereas the bucket is only a temporary issue. So this is another tool that we like to use for asthma. We have some patients getting 6 of these short-acting beta-2 agonists a year. That's 6 times 200 canisters. That's potentially 23 puffs a week they're using. For a person with good asthma control, they shouldn't need to use their blue inhaler more than twice a week. That will be a maximum of 4 puffs in a week. This person may have used 23 puffs in a week. This is not a good indicator of good control. So, and that's potentially 600 to 1,200 breathless moments they've experienced. And that would make me feel very uncomfortable if a person was living with a lung condition like that. So tools like this from the International Primary Care Respiratory Society group or the Primary Care Respiratory Society are really useful. You can also use the lung tubes, as I say, which I keep the lung models to help illustrate what good and bad asthma looks like. And the Primary Care Respiratory Society also highlights it's a bit like a volcano. Your asthma could erupt at any time. But if you can help dampen down the embers in the fire, then that will help keep your asthma at bay. And unfortunately, we have one of the worst outcomes, probably the highest children's asthma deaths, unfortunately, in Western countries across Europe. It's not good. So this is why I think us pharmacists need to do a lot more to empower patients. There's good national standards, like the UK Inhaler Group have got national standards about good inhaler technique. As I said earlier, the importance of why I'm passionate about respiratory is that we can really do a lot when it comes to, as I say, not only the waste of medicines, poor disease control, improving a person's quality of life and reducing hospital admissions and reducing cost with good inhaler technique. This is amazing work we can do. And as I said, the environmental impact is huge as well. But choosing the right inhaler isn't always easy. And there's also nasal spray technique. A lot of asthma patients, for example, suffer with things like allergic rhinitis. So helping coach a patient on how to use their nasal spray or using their inhaler, I think is a great rewarding role that we can all play. Believe it or not, from research that's out there, 9 out of 10 of us healthcare professionals may make a mistake when using one of those puffer type inhalers, like the brown one you can see in the image there. 9 out of 10 of us from research may make a mistake. There's 7 steps to good inhaler technique, and making one mistake can result in 0 to 10% of the drug reaching the lungs. So just by doing one major thing like that, correcting and coaching a patient's inhaler technique, and also clinicians' technique as well, because they're the ones who are going to be coaching patients, is really key. But even people with dry powder inhalers can also make mistakes. So it's really important to go through these with patients. And spacers, unfortunately, are not used by a lot of patients. You'll see a lot of images in the media that just show the meter dose, the puffer inhaler used by itself without a spacer. And you can see if something's going to be coming, like the propellant and the drug is going to be coming out really fast, most of it will end up at the back of the throat. It has to get around the bend. So tilting your chin up, using your spacer and breathing in slow and gently over 3 to 5 seconds to allow it to go around the bend is really, really key. So I'm not going to go through those 7 steps today, but it's just for that awareness that you know that lung deposition with the right treatment will help that patient live better with their lung condition. And of course, the non-pharmacological support around increased activity, not smoking, not vaping, for example, can be really important. This is just to say what I was really happy to get involved with was writing up my piece of research, and I'd strongly encourage you to do that once you guys become qualified pharmacists, and if you go into the area, whatever area you're going into, and you want to get involved in a quality improvement program. I was the respiratory lead pharmacist across the Barnet area at that time, and now I'm a clinical fellow pharmacist across Northwest London Integrated Care Board. You can obviously build your experience, but getting this all documented into journals is really rewarding. So I helped support in spacer inhaler technique and dry powder inhaler use, etc., in community pharmacies and GPs practices across the borough. And this was actually recognized at the HSJ Awards. We actually won an award. It was highly commended, and it was all the local media got involved with that as well. And just recently, we've got another HSJ award in Northwest London for something else around using data, clinical data, to help drive change as well. The power of data these days, we can find out potentially at a population level who's at risk of having future asthma attacks by, for example, patients not using their anti-inflammatory treatment, people overusing their blue inhaler, people who have attended emergency departments regularly, people who've had courses of oral corticosteroids, people who are living polluted areas, who are smokers. Lots of things we can do. So I'll just give you a bit of an overview of COPD before I finish off, and then see if there's any questions any of you've got for me as well. But done some similar pyramid for COPD, and that's highlighting the highest value interventions, which are smoking cessation, pulmonary rehabilitation, vaccinations, flu, pneumococcal, COVID vaccinations, indoor and outdoor pollution are things that we can really do quite a lot around. Again, it's just similar to the last pyramid, but a lot of it's around self-management as well, and giving personalized self-management plans so patients know what to do when they've left your practice or your pharmacy or wherever you're working. We've got tools like this. This is from the International Primary Care Respiratory Group. This is a nice wheel which we prepared. This just gives an idea. A lot of patients with COPD don't know what COPD is. It's not the greatest name, COPD. What does it mean? And some people get the wrong idea. They think it's like a death sentence. They think that's the end, you know, or and it's not. People can live well with COPD, and they do live well with COPD. So it's around giving those that bit of information around what they can do. And some of the language that clinicians have used, unfortunately, have been quite negative. So this is why our roles as pharmacists is to help turn it into sort of be honest about it. Obviously, they've got obstructive airways disease, and it's not going to be fully reversible, unfortunately, but that doesn't mean that they can't live a good quality of life. And there are lots of treatments available. A lot of them are non-pharmacological. So the language, instead of using words like irreversible or incurable, etc., we can use positive words like around, I think increased activity is going to be one of the great things you can do with pulmonary rehabilitation. I don't like to use the word pulmonary rehabilitation because a lot of patients do not know what that is. But we can help a person breathe better. We can help them become more active. We can help them move better. And in fact, with this type of activity and education, that person can go on to potentially go back to work if they were off work, or do things they weren't able to do before. So there's lots of things that we can do to help patients, and it's a manageable condition as well. So when we're thinking of our precious airways, a lot of us will think about I guess a tree with its branches, and those branches eventually end up down at the alveoli. Some of these particles, like you can get from car exhaust, like PM 2.5, they can reach the smaller airways. So trying to do our bit for pollution, but smoking, of course, can actually destroy a lot of the tissue around the smaller airways and larger airways. So hence why my first picture with my tar jar, I think is just a message that anything organic that you smoke generates tar, it generates carbon monoxide. So this can really cause a lot of problems. And I think when it comes to stopping smoking, as I said earlier, the people in our society that can least afford to smoke, and it's expensive as well, unfortunately, they're the ones where smoking prevalence is highest. And it means that sometimes people are so addicted that they don't eat, they don't heat their homes. And this is not a good, to help a person come out of this, they feel trapped with this addiction. We can do a lot as pharmacists, and that's why it's one of the most rewarding things I've ever done in my profession when I've helped people go smoke-free over the years. As I say, smoking and pregnancy, the job isn't done yet. There's a lot going on there, and we need to support. A lot of our hospital beds are occupied by smokers. 1 in 5, unfortunately, are current smokers. 1 in 2 patients on mental health wards. People with serious mental illness lose, on average, around 20 years of life. This is not right. For every 2 people we help stop smoking, we save a life. Just amazing. 2 people, numbers needed to treat to save a life, 2. So, it's just, and not only are they losing 20 years of life with the people with serious mental illness, but they're also, their quality of life is really affected, and they're entering old age much sooner. And smoking, of course, interacts with quite a lot of medicines. It makes inhaled corticosteroids less effective, for example. And 5,300, we talk about chemicals, down to 1 if you're using a clean form of nicotine. Sometimes people smoke shisha or water pipes, hubble bubble, hookah, they've got different names. The World Health Organization has said that 100 cigarettes worth of smoke in an hour session of shisha, 100 cigarettes worth of smoke. Carbon monoxide levels go off the roof. You can use the carbon monoxide machines in pharmacies and to empower patients to go smoke-free, because it only takes 24 hours for it to come out of your system. We can use the 30-second approach, ask, advise, and act, to make that intervention. Do you smoke at all? Did you know the best way to stop is with a combination of support and treatment, which is available on the NHS? Would you like to consider stopping? We've helped lots of people stop. And we act. If a person's not interested, our door is always open when you are ready to stop smoking. If they're interested, well, we can signpost you to our local service that we've got available to help you. So there's so much we can do just within 30 seconds there. Sometimes I say to patients who have got flu or pneumonia, they're coming to get their COVID vaccine, I say you're 5 times less likely to get flu if you're a non-smoker. That may encourage a person to go smoke-free. Cigarette smoking amongst the young has declined, which is great news. But we have to watch out for the rise in vaping. So again, lung health and vaping or e-cigarettes is high on the agenda at the moment. And there is something for us to be really watchful of and keep an eye on. Such a diverse role, respiratory and pharmacy. That's why I love it so much. Any questions for any of you?
I don't know if anyone has any questions. I have. So basically, like how there's an increase in vaping, especially like in young kids, especially like teenagers. The youth now, all they know, everywhere you go, you'll be exposed to a vape, and a lot of times they don't really know the impacts on vaping because it's not spoken much about. They think, vaping is not as bad. It's only cigarettes that is bad. As long as, I'm only vaping, it's nothing too bad. It's not going to affect me, well, not for a long time. So it's just like, how can we give those, young people sort of advice, like anything that's entering your lungs that's not meant to be bad is equally as bad. So, that type of thing.
Yeah, I mean, the key messages we get across is if you don't smoke, don't vape. If you're a young person, so basically, if you're an ex-smoker and you're a smoker, vaping is a good option to help a person stop smoking or prevent them from relapsing back to smoking. So we got to look at the levels of harm. And vaping, we can never say has got no harm. We can say the level of harm will be a lot lower than smoking, absolutely. And that includes shisha, as I showed earlier on as well, because it doesn't involve combustion. And this is why the National Centre for Smoking Cessation and Training suggests we never use the term e-cigarette because it's artificially giving this impression that it's like a cigarette, which it isn't. It's like evaporation. But you are introducing foreign bodies to your lung. And these things can obviously have some potential of problems. And so this is why the key message, as I said earlier, if you don't smoke, don't vape, and we should not sell to under 18s. So that's really the sort of key messages there. But the other thing is just to have the awareness, like I have in one of the slides. The main thing to know is you've got a battery, you've got an atomizer, which kind of heats it up and boils it like a kettle would. You've got the e-liquid. In the e-liquid, you're not allowed to go more than 20 milligrams per mil of nicotine. That's a maximum strength. But the flavoring agents, there's over 7,000. So we have a drug regulator called the MHRA, and the drug regulator, each company who makes vaping devices should send a dossier of information to the MHRA so we can understand more about the ingredients of what's in it. What I worry about this is the sort of the black market, so to speak, where things are being sold online and people are getting higher strength and they're being found in school. So it's not as regulated as it could be. So that's my concern, and I think yeah, we'll find that actually with this regulation, hopefully that will help reduce that problem in the future.
Does anyone have any questions? Feel free to put it in the chat, or you can unmute yourself and ask a question if it's a bit wordy.
By the way, the Cochrane data does show vaping being one of our most effective stop smoking aids. It's showing it's similar to a drug called cytosine, which has now become available. There was a drug called varenicline, which is not available at the moment. And it's meant to be more effective than nicotine replacement therapy, which is, what we tend to recommend as prescribers. So on efficacy, it's quite exciting, but as I say, it has its disadvantages there as well.
That's amazing. I mean, the topic's really broad. It's just really interesting, seeing all of these things. Because it's like, wow, there's so many big, things in respiratory that you can literally have a look in, and it's just like, it's really fascinating to me. I find it really interesting.
Good.
Yeah, but does anyone have any more questions? Don't be shy. Put it in the chat. Well, if we do have questions in the meantime, while we wait, thank you so much, Darush, for taking, your time out of the day. And, the work that you do is literally really amazing. How far you've come yourself as well. It's just, when you sit down, you just look at it and it's like, wow, that's such an inspiration. Obviously, to like us students who are going to be the future generation of healthcare professionals, and the way, like, stuff is changing so quickly, various, like, stuff arises, like for example, the vaping in the young in the youth, will eventually rise and it will become a really big problem. And when these things are, spoken about earlier, you start to find like solutions and stuff like that quicker. So yeah, that's amazing. I don't know if anyone has a question.
we are probably going to have vaping cessation services in the future, as you say, because the uprising of it, and it's addictive, as we know, nicotine. But it's not the nicotine that kills, actually. It's the tar and the carbon monoxide that we need to, which it does is in vaping. But just to a final message on vaping. I was trying to remember what I've got this sidetracked there, but just to say, yeah, it's gone now. There's so many messages in respiratory. I just think it's so exciting that you can go in. Even you were talking about pharmacy, and then one area of pharmacy is respiratory. And then in respiratory, you have so many areas as well that you kind of think you could specialize even further. So it's the world's your oyster. It's a great degree to have, and I wish you all the best of luck, everybody, with your future careers.
Yeah. Thank you so much. You can see the chat, right?
Yes, I can. Thank you. Yeah, that's good.
Yeah, this has been amazing. Again, thank you so much for taking this time out of your day to be part of us and to be able to share the knowledge that you have. Because I've learned things that I didn't know. It's just like, wow, it's really amazing. So keep up the work that you're doing, and thank you so much for joining us today. And what's your information? Like, if anybody does have questions or any further, your email,
Yeah, I'll put that in the chat if anyone has any questions. There you go.
Yeah, thank you so much,
Bye.
Darash.
Bye.
You have a good rest of your day. Bye bye.
Bye.
Okay, guys. So yeah, if you guys have any more questions for Darash, his email is left in the chat. So you can email him about anything, literally in respiratory, if you have questions that you're not sure about, or if you want to go into, by the time, you come to qualify, you want to know a little bit more information on that. It's always lovely to have a chat with, email him, ask him questions. And also if you find anything interesting in the slides that, he was talking about, his email's right there. You can ask him, like introduce yourself. I came from the talk today, and he can send you the slides as well. So yeah, and we have our next speaker. She's with us. Shamsa is in the building. So let me go back to the PowerPoint presentation. Let me share my screen quickly. So that was the Russian part. So the next speaker we have is Shemza, and she's the IPSF officer. I'm not going to do too much speaking. She can do a little introduction for herself because she is here. So Shemza, whenever you're ready, you can shine. Yeah.
Thank you so much, Philippa. Thank you guys for having me today. I just wanted to, I guess, break up your day a little bit, and kind of talk to you guys a little bit about my role. I think it's a really good opportunity to get you guys more knowledgeable about the international opportunities that there are with BPSA, because there's the UK. It's not extensive, but just the UK. There are so many other opportunities all around the world that if you are interested, this is something to kind of give you more information about. So like Philippa said, I'm the IPSF officer for the BPSA. So I sit on the executive team with Philippa. And my role is essentially just acting as a liaison between something called the International Pharmaceutical Students Federation, which is what IPSF stands for, and BPSA. Like I mentioned, I just wanted to give you guys more of an insight into what we do, what we offer, and the opportunities there are available for you. So what I'll do is I will share my screen if that's all right. Philippa, I think you might need to stop sharing so I can share. Thank you. So yeah, it's just gonna be like a little IPSF 101. Like I mentioned, just to get you guys introduced to the concept if you've never actually heard of it before. So, like I mentioned, IPSF stands for the International Pharmaceutical Students Federation. It was founded in 1949, proudly by the UK, by 8 pharmacy student associations in the UK at that time. And that's something that we bring up from time to time. Oh, IPSF was, started by essentially BPSA. But now it's risen to representing approximately 500,000 students all around the world in 92 countries. I say students, but also recent graduates, because the criteria or the eligibility criteria to be part of IPSF is you can even be part of it 4 years after you graduate. So if that's something that you want to get into, you want to get involved in more, that's still open to you 4 years after. So IPSF is the reason for IPSF is to advocate and represent pharmacy students similarly to BPSA, but obviously on an international platform. And so with this, IPSF provide a lot of education and networking opportunities. So this can be through different events, such as professional activities and publications and so forth. And so this presentation will hopefully get you involved in that and get you interested in wanting to know a bit more about it. So I think it's really important when we talk about IPSF to start from like how it's structured, because it's very important into understanding a little bit more about it. So IPSF, whilst it has its kind of one big whole thing, obviously for it to work efficiently, it needs to sort of be governed by different sort of what we call regional offices. So there are 5 regional extensions or offices of IPSF. So you can see them listed here. We've got European Regional Office, Asia Pacific Regional Office, African Regional Office, so on and so forth. And these are abbreviated down to like Euro or APRO or AFRO. And you'll notice that a lot with IPSF, there are a lot of abbreviations. I think even to this day, I get so confused with what's what, and I have to do a little search, but you get used to it. So we're obviously within the European Regional Office. And the reason why I bring this up is because, like I mentioned, whilst IPSF is a big federation, each of these regional offices still kind of work independently as its own sort of entity. And so with that, they have their own projects, they have their own events, and they have their own activities and, professional development activities that they do. And so if it's the case that, you miss something on the IPSF global platform, there's still opportunities within the Euro platform to get involved with. So before we get more into IPSF and what it offers, I just kind of wanted to share my journey, because it's not been a long one. I mean, it's been like 2 years since I started into sort of the world of international pharmacy. So 2 years ago, I started as the SEO, so the Student Exchange Officer. And this was a role that I did not know about at all until I attended the annual conference, the BPSA annual conference, which, little plug, it is happening in the next couple of weeks. So if you are going, you'll see us. And yeah, at this point, I didn't know anything to do with international pharmacy. I had no kind of knowledge behind it. And so when I went to annual conference and there was a sort of presentation on IPSF and other international opportunities, such as EPSA, which is the European Pharmaceutical Students Association, it kind of got me more interested into what it offers. So from the annual conference, I came out as the Student Exchange Officer, which is a subcommittee member role of the IPSF officer. And in this, my role was to facilitate and organize exchanges for international students, but also help UK students find placements abroad. So this is me. So we have 2 exchanges or exchange periods. We've got the winter student exchange program and the summer student exchange program. So the winter student exchange program is what you see from these photos here. Actually, no, the first 2 is the winter exchange program, and then the third one is from the summer exchange program. But yeah, we got so many, I met so many amazing people, amazing students from different countries, from Korea, Hungary, Thailand. And it was such an amazing experience to be able to provide these opportunities for students as well. I think that was a really nice aspect of it, and to also meet them as well. So yeah, I started as the student exchange officer. Then in Portsmouth last year, I ran for IPSF officer, and that's just kind of been my journey. So I guess the reason why I bring this up is just to kind of give you an idea as to one route you could take into it. There are so many different opportunities as well. Like I mentioned with the regional office, there's already opportunities within that, like different subcommittees or different roles. They have their own executive team as well. So if that's something that you'd want to try and go for, there's that. So more into, oh yeah, so this is last year in Portsmouth at the ball night. So the last day, the last social night that we had. And yeah, you can see all of us, the Portsmouth AC group. And yeah, this is when the night after I was like elected for IPSF officer. So a lot to celebrate. Yeah, a nice little round off to AC. So in terms of what IPSF offers, there are so many different elements of it that this whole slide is not even extensive of all of it. There's so much more, but just kind of like a brief summary, I suppose. So there are 3 different portfolios to IPSF. So there's the professional development portfolio, pharmacy education one, and the public health one. So the professional development portfolio, under that comes like a myriad of events that happen, and opportunities for you to essentially develop on your soft skills, and also your clinical skills. So for instance, you got the clinical skills event, the industrial skills event, if industry is like a route that you'd want to go down, patient counselor event, which is essentially just OSCEs, compounding event, and then you've got the leaders in training and trainers development camp. These events generally happen around the flagship events, which is something I will bring up later on. But they can also happen within the regional offices. So for instance, in the European regional office, there was the clinical skills event that happened a couple of weeks ago. That if you follow the Euro socials or even the IPSF, BPSA social, like Instagram, you would have seen kind of call for applications for people to apply to it. So that was one of the events that was ran. And then you've got the pharmacy education portfolio. Now, this is more to do with, again, developing your clinical skills, but I guess showcasing what you've done previously. So for instance, the pharmacy education newsletter, that's a really good opportunity for if you've got like a research paper or kind of an article or even a poster, maybe for your dissertation that you did, you can submit it into the pharmacy education newsletter or even the Young Researchers Forum. And yeah, just have your work showcased. And again, a really good thing, if research or academia is a route that you want to go down, it's a really good opportunity to kind of get started in that and have some experience in submitting articles or whatnot. And then you've got kind of internship opportunities that fall under the pharmacy education portfolio. So there are a lot both like global and also within the regional offices in terms of internship opportunities. There's one application kind of going around right now, which I'll mention later on. And then you got your public health portfolio. So this is just kind of like your public health initiatives. And a lot of the public health initiatives align with IPSF's partners. So for instance, the 2 partners that we have are like WHO and United Nations, we have UNICEF and other organizations such as that. So a lot of our public health initiatives, are partnered with them. And then you've also got, so one thing I didn't mention was the student exchange program, which I mentioned before, but it's not under a portfolio because it's more of a project. So it's the largest project that's run by IPSF. There are over 60 countries to choose from, and you can have placements in, for instance, community, hospital, industry, academia, and research. So that is definitely something to look into if it's something that you'd be interested in. Now, I mentioned the flagship events. So the flagship events are really, really important events within IPSF because they serve as an opportunity to, I guess, reflect on the mandate or reflect on the year previously that's just happened, all the things that have happened, all the advocacy events or activities, and seeing how we can essentially improve IPSF yearly. It's also a great networking opportunity and a great time to kind of, so for instance, during my role as SEO, I liaise, and even now as IPSF officer, I've liaised with a lot of other student exchange offices or IPSF offices in different countries, you know, through emails and everything. And so it's such a great opportunity to kind of see these people in real life, because, you know, 9 times out of 10, it is the fact that you're just like communicating with them over email or text. So it's really good, really cool to see them in person. And yeah, so the flagship events, there are generally 2. So like I mentioned, there are 5 regional offices within within IPSF, and each regional office have their own regional symposium. So the regional symposium, I like it to kind of AC. It's very similar to AC in that you have your workshops and your activities that you can do. And by AC, I mean annual conference. So the BPSA annual conference. So like you can do that. There are a lot of workshops to be involved in, activities. There are speakers as well. And then you've got the conference side of the regional symposium, which is known as the regional assembly. And this is the highest decision-making body within the regional office. So this is like I mentioned, it's an opportunity to reflect on the mandate. Motions are submitted, which are then debated on, and then if they are passed, they are put into policy, and they're put into sort of, and by policy I mean as though it's what we have to work on throughout the next mandate, or I believe throughout the next 3 mandates, depending on how the motion is worded. But yeah, it's a bit complicated to explain now, but it's definitely, it makes sense once you're in it. And then you've also got so you can see here on the left, the 4th regional symposium happened last year. It was in Bern, Switzerland, and that was me and all of the other BPSA members who attended. And then you've also got the World Congress, which is now part of the IPSF global platform. So it's where all the regional offices, come together, and all its members, they come together, and yeah, it's a similar event. And there's a symposium side, and then there's a conference side. So there are so many other people who participated. This photo is not all of them. I believe this was just like the student exchange offices, or like of some of the countries. But anyways, this happened in Bali, Indonesia last year. So that was an amazing time. They typically last for like 5 days to like a week, usually, or like 10 days. Yeah, somewhere between that time frame. But again, amazing opportunity. And so this leads us nicely onto this year's flagship events. So I'm not sure if you guys have followed the Instagram account, like the BPSA, IPSF Instagram account, or even the World Congress or the other IPSF Instagram accounts. But currently, what's been promoted been promoted a lot is the 69th World Congress, which is happening in Incheon, Republic of Korea. Again, the same event, but obviously happening in Korea. And yeah, the itinerary, the schedule, everything looks amazing. So I really would implore you guys to go and look on the Instagram accounts for more information. And just to say that the second registration phase, has opened now. So it's now open for you to go and buy tickets. If it's something that you are really interested in, I would encourage you to go buy them as quickly as possible, because the last phase, they sold out within like under an hour. And there's also a specific quota for this phase as well. So once that's done, even if it doesn't reach, once the tickets have sold out, that's when phase closes. And then there is a 3rd phase. But one thing to note is that the prices do increase from the 2nd phase to the 3rd phase, I think about by 50 euros. So yeah, there's that. And now the regional symposium, as you can see here, it says the 13th regional assembly instead of saying the 5th regional symposium. The reason for this, unfortunately, is because there hasn't been a country that has put themselves forward to host the 5th regional symposium. And so it's now gotten to the point where we can only host the regional assembly side, so the conference side of things. As you can see here, it says it's happening in the Netherlands, in a city called The Hague. The reason why it's happening here is because The Hague is where the HQ for IPSF is. So it's being organized by what we call the regional working group, which is essentially the executive team of the European Regional Office. There are so many words, so many things, and yeah, it can be a bit confusing, but essentially what you just need to know is that the conference side of things is the only thing that's going to be happening. Unfortunately, the symposium event is not going to be happening this year, but hopefully next year we can go back to the full event. And just to note, the World Congress is happening between the 9th and the 17th of August. So yeah. So now, what is actually, I've told you about the opportunities and what IPSF offers, but what is actually happening now at the minute. So for the events that I just mentioned, but also other events that are happening. So for instance, if you've registered and applied for and you've been successful in being accepted on the European Regional Office Trainers Development Camp in Czech Republic this year, the travel fund is something that is available for you to apply for. Also, if you've gone forward with the student exchange program, or if you're wanting to go for World Congress, then BPSA essentially each year allocate a certain amount of money and put it to the side for students who are in need of financial assistance to be able to go to these events. One thing to note is that the awarding funds are reimbursements rather than something paid out upfront. So it is something that you would need to confirm that you've actually been to the event. And if you are successful, then it will be a reimbursement. Other events happening is World Down Syndrome Day. So there is a charity competition that the European Regional Office are hosting, and that is on the 21st of March. So it's something that you'd want to get in. It's a really fun night. It's just kind of like a quiz night. I'm not sure. I don't know if it's like I think it's a general knowledge quiz night, but it's a really good opportunity to get to know other people within the European Regional Office, as well as the regional working group I mentioned. Because they'll be there. And yeah, minimum to be able to enter, you have to do a minimum donation of €2, 50 cents. The reason why it's in euros is because IPSF works in euros. So yeah, everything that you'll see is in euros. But yeah, if you convert that to pounds, it's probably like £1 something. I don't know the conversion rate, but something around that ballpark. Yeah, so that's for Down Syndrome Day, the charity competition. And as I mentioned previously, there's a pharmacy education newsletter that we have, and this is more for IPSF Global. So if there is, like I mentioned, a research paper or an article that you've done or a poster that you've done that you really want to showcase, you can submit through that. And a couple more things. Like I mentioned, there are a lot of internship opportunities. So at the minute, there's an internship opportunity for what's known as the Alliance for Healthcare Professionals. And you can see there the different positions that they're offering. And deadline for that is the 22nd of March. And also, so there's something called, so I don't know if you guys have ever been introduced to, but it's called the FIP. So FIP is the International Pharmaceuticals Federation. So you see how with RPS, BPSA are the student organization of RPS. IPSF are very much similar to that with FIP. So IPSF is the student organization for FIP. And FIP are having their World Congress in Cape Town, South Africa. So if that is something that you'd want to be interested in, also feel free to look more into that. But yeah, so that's everything. If you do want more information, these are my social, this is my email. And you've also got Christina, who is the current SEO. That's her email. If you've got any SEP related queries, we've also got the BPSA IPSF Instagram account here. So if you really want to keep up to date with all the IPSF related activities and events that are happening, do follow that. You've also got the main IPSF Instagram account and the IPSF Europe Instagram account, and also the World Congress Instagram account. A lot of Instagram accounts, but I promise they are all worth following if you really want to, not miss any opportunities. But yeah, thank you so much. I will stop sharing now. And if anybody has any questions, please do let me know this time.
Thank you so much, Samantha. That was literally really interesting and amazing, seeing all these opportunities that are available for all these students. So guys, while you're still young, use these opportunities, to develop yourself and develop your career in pharmacy. And then networking is so important, let people know who you are, the good stuff that you do, because there's power in networking. Well, you guys, if you have any questions for Samantha, you can drop them in the box below, or like as we said, like just follow the IPSF Instagram and Insta, then you'll be able to see the different Instagrams from IPSF that are available. Or you can go to our BPSA page and then search for IPSF there. And anyone have any questions? 2 minutes. We're going into break time, guys. I know it's overrunning, but as I said, we're going to finish earlier. So like you'll have even a longer break because the whole conference will finish an hour early. So does anyone have any questions for Shemsa before she goes? Oh, Shemsa, thank you so much for joining us. Yeah, she's left the Instagrams in the description chat. So guys, have a look. And yeah.
We've got one question, I'm not sure, from Temi.
Oh yeah, you know, for the World Congress, is the like plane ticket to get to Korea included?
No. So for the registration tickets, it will just be for the entire event. So it'll be for accommodation. It won't be for flights. It'll just be for accommodation. All the social nights, food, yeah, and everything that happens during the event. So the idea is that you won't have to pay any extra expense apart from obviously if you need to pay for visa or for flight tickets. So that will kind of be the only extra expense outside of the registration ticket, so you'd have to pay.
Oh, okay, thank you.
Can you see it now? I think it was just being posted on the panelist before, but yeah, you can see it. Do you have any more questions, Summer, or any questions? Anyone before Shem starts to prepare? Wow. Yeah. James, thank you so much again for joining. And I don't think anyone has any more questions. But if you do have any more questions, you know where to go, you know, some Shem's details. Her email is right there in the description chat. And follow these other things to find out more. But yeah, Shemza, you're free to go. Thank you so much for joining.
Thank you so much, Philippa, and hope you guys enjoy the rest of the conference. Bye.
Bye. The sun is so bright, guys. But I need to put my blinds down. But yeah, guys, essentially, so thank you so much for holding on tight. You know, we will finish earlier. So for now, what's going to happen is it's going to be lunchtime, and bear with me a minute. It's lunchtime. We're coming into the hours of lunchtime. So there's yeah, let me just update you guys on the lunchtime, how it's going to work and what time you guys should come back. Okay, so if I say you guys go to lunchtime now and come back at 1:30, so it's roughly around, is it 25 minutes? 25 minutes of lunch. I hope you guys are okay with that. And please be back on time because we have our other speaker. He's going to be what he's called Deval. He's going to be talking about the different types of you know, the inhalers and how you can use the put in the name. The name is gonna out of my mouth. But what's it called? Deshaun displayed the picture before, and you know when you were using an inhaler, and instead of directly using it, you have it's gone out of my mind. You have the thing that you have to apply to it before. So our next speaker, Deval, will be talking more about that. So he's coming in at 1:30. So please be on time when you're back from your break, just not to miss him. So like come back that 5 minutes earlier if you're happy to come back 5 minutes earlier so that we're just ready in time for when our next speaker is going to come. Or if you don't want to leave, you're free to stay as well and just wait for the time while you're on the call, but just mute yourself. So yeah, you guys are free to have break time, lunchtime, and oh sorry, Chinaza, sorry, have your hand raised. You have your hand. Sorry, there's a hand raised. Were you saying something? Was
Yes.
that
I wanted to ask a question to the other girl, but then she left.
Oh, I'm so sorry. What was your question?
I just wanted to ask her more about like the events that she was talking about, but I suppose then I could go on the Instagram and look at.
Okay, yeah, okay. Reach out to her, like, reach out to her on an email. I'm pretty sure you can see the email, right? And also the IP Steph account. Reach out to her. She will respond back to you. And ask her. Feel free to ask her as many questions as you can. Yeah, I hope that helps. But I'm so sorry that you didn't get time to ask her while she was on the call. But for now, guys, yeah, that's sort of the update. Yeah, it's now lunchtime. If you want to stay, feel free to stay on the call, but just mute yourself. And yeah, I'm also going to mute myself and turn off my camera. But I will be here if you have something to say or if you just want to have a chat. I'll be in the background. But for now, thank you so much, guys. It's lunchtime, and Emma has repeated it as well, and she's put her name in the email. So yeah. Thank you guys. So it's lunchtime, take a break, come back and be, ready to listen for the most stuff that we have. Deval, so yeah, we just came back from a break right now. So yeah, guys, we're going to proceed. We're going to continue with the conference. So welcome back from the break. And let me just share my screen and do a little introduction on Deval, and then he can talk more on the introduction and build it himself. So let me just share my screen. Okay, we just came back from our lunch break, and then we have our speaker, Deval. So welcome, Deval, to the conference. Thank you so much for taking your time out to come and be with us in this afternoon of your day. So I'm going to let you do a little bit of an introduction about yourself, and then we can get started. So I'll stop sharing my screen because actually I'll share my screen for now, but if you want me to stop sharing, I can stop sharing, and then you can, if you have any slides, you can present them. I hope you can hear me. Can you hear me, Deval? So as we sort out any little technical difficulties as we wait for Deval to speak, yeah, so that's what we're doing for now. I think Deval's having some technical issues, so yeah, we must have to solve that because he's left, and I think he's going to come back. Okay, there he is. Yay. Can you hear me okay? Oh. Can you hear me, Deval? Bear with us, guys, as we solve any technical issues. Bear with us, guys. As we don't solve any technical difficulties.
Recording in progress.
Bear with us. Thank you for holding on to solve any technical difficulties. Ooh, we're really struggling here, but promise we'll be with you guys in a bit. Just bear with us as they try to connect. Deval's trying his hardest to connect. I think the audio is failing him for a minute. But if you guys can hang in there, we'll soon have him speaking. Can you guys hear me okay? Sorry, just to ask. Can everyone else hear me okay? Okay. Thank you guys for bearing with us as we solve this technical issue. Okay, Deval, can you hear me okay, like on your end? 'Cause, I don't know if you can hear me. Okay, guys, what's it called? You guys can have like a 5-minute break while we sort any technical difficulties out. and we'll come back shortly. Yeah, so we are going to resume again. So let me share my screen and just do a little bit of an introduction, and then she can finish off, rest this up. Okay. So guys, hi everyone. This is Rehna, and she's also a clinical pharmacist, and she has experience in respiratory. And yeah, we're going to hear from her in the meantime. So yeah, take it away when you're ready. Let me stop sharing my screen.
Oh, let me unmute. You cannot start screen share while the other. Oh, okay. It says I cannot start screen share while the other
It should be
participants. It's okay.
it should be now. Yeah, I've stopped screen sharing, so it should be fine. I don't know. Have another go.
Share screen. Share. Is that right? Are we seeing it?
Yeah, I can see it. Can you guys see the screen as well? Can somebody type it in the chat?
Is it okay?
It should be okay, but I'm waiting for confirmation from one of the people. Yeah, they can see it. Yeah. Yeah, they can see it.
Okay.
We can start.
Okay. Thank you, Philippa, for inviting me to have this chat with the prospective pharmacists of the future. As I prepare to exit out of the career, obviously all you young people are coming in. So I'm quite happy to share my knowledge. I've had over 25 years experience in clinical pharmacy, so I hope I can answer some of these questions this afternoon. The other thing I want to say is I've prepared something as a conversation starter, but obviously I'm quite happy to take questions if that's a better route to understand what is going on. I've practiced respiratory pharmacy in a number of hospitals and some communities, some GP services, but mainly my background is heavily hospital based. So obviously the lungs, I like this image, and if you have a look at the lungs, anything can go wrong in terms of respiratory. When Philippa called me up, I was thinking, oh my goodness, it would take probably about 2 weeks to cover everything that can go wrong with your lungs. But you have a look at the lungs. If you remember that anything can go wrong with the lungs, from the tracheal to the lungs themselves, the cells themselves, something can go wrong with them. The ability to expand and contract can also be affected. The wetness of the lungs, the oxygen exchange can be affected. The pleural, the sac that covers the lungs can also be affected, particularly with lung cancer. So the whole lung can be encased in a fluid that's cancerous, or inflamed, or just not functioning very well. It can calcify. So bits of lung can calcify, and you can get wounds in the lungs. You can get pus in the lungs. You can get fluid collection, blood collection. So anything can go wrong in terms of respiratory. So when Philippa asked me to talk about respiratory, I thought, oh dear, that's a very large topic indeed. And some pharmacists obviously specialize in respiratory. But what I tried to do is I asked her some questions. So, or I asked her to send me some questions. So I've put the questions here in orange. So one of the questions she wanted me to answer was, what are the common or frequently encountered respiratory diseases? And obviously everybody, I think, on this topic, on this webinar knows about COPD. I think, is that right? I don't know what year everybody's in, but COPD is something you will commonly encounter in the community and hospital, and asthma is the other respiratory condition that you're more likely to encounter. But there are others. Obviously, you can have obstructive pulmonary disease and chronic obstructive pulmonary disease as well. which can be a combination or a result of so many things, typically smoking, but it could be, working in the mines, or, some fibrosis, asbestosis, all of those things can lead to COPD. And chronic bronchitis is another one. We have emphysema, we have lung cancer, cystic fibrosis, which is a genetic condition, which hopefully as we advance in genetics, we can reduce, because that's a life-limiting condition. We can have pneumonia and pleural effusion. So these are just some of the things that you might come across as a pharmacist, and certainly you need to be able to deal with them if that's the right way, or certainly advise the team on how to manage these conditions. All these conditions, possibly other than asthma, are really chronic, lifelong, and the patient is not going to get better. Some people do grow out of their asthma as their thymus gland, shrinks or whatever. But some people do not. But all the other stuff it can only get worse as the patient gets older. So their needs will be changing with time. So one of the questions was, oh dear, I didn't put it in the right font there, was how do you approach how to help these patients? You approach it in the same way that you would approach all the other conditions that you treat, whether it's heart failure or pain, just general pain, back pain, or DVT, or whatever it is. So as a pharmacist, what makes you a slightly better pharmacist than somebody who just passed their exams is really putting yourself in the shoes of the patient. So you need to look at the patient and put yourself inside that patient, and then start to think like the patient. If you have that mindset, you will always be able to solve the patient's, or you'll have a better understanding of the patient's problems. So some of the questions that when I'm dealing with these patients, I ask myself is, what am I actually dealing with in this particular situation? Because we're all very quick to say, oh, go and use your inhalers twice a day, your painkillers is 4 times a day, your antibiotics is every 6 hours. But we actually don't understand what we are treating. The patient may be in denial about their disease. The patient may be angry that they have this disease. What are you actually dealing with? So take a bit of time to ask the patient, how is this condition affecting them? And then you'll be able to tailor your answer to that condition. So the other question I ask myself is, what am I expecting them to be taking, and why? So if they've got asthma, yes, I am expecting them to be on a beta-2 agonist, a salbutamol, a terbutaline, or whatever beta agonist is out here, a beta-2 antagonist is out there. And if that is not the case, then I ask myself, why is that not the case? So you'll typically get a patient. It's not unusual for me to be working, say, in a shop or doing a locum on the weekend in Manchester, and somebody comes in and says, oh, I left my blue inhaler in Wales with my grandma. So they don't have it. That's why the condition is getting worse. And then what are you going to do about it? It might be, for example, when you're dealing with these people, I remember having a case where the patient, a child, lived with 2 parents at different addresses because the parents were not getting on. So when parent 1 kept the child for the week, they refused to take their inhaler to parent 2, and vice versa. It sounds really childish, but these are some of the situations that you're dealing with. So father or mother refused to send the patient to parent 2, or mother, whichever way, with their blue inhaler. Sounds crazy, sounds nuts, but this is what you're dealing with. So why are they not taking it? So in that situation, you may have to explain and have a set of medications that stays at parent 1, and then you have the same set of medications that stays at parent 2. or grandma or whatever it is that they, or school, for example. So what am I expecting the patient to be taking, and why? What are they using? Why are they not using it? What has happened in this situation? And then you need to ask yourself, what are they actually using, and are they using it properly? So typically you will say to your patient, are you using your inhaler? Yes, but it doesn't work. So as a pharmacist, you need to investigate that a little bit further. And believe it or not, you know the cap on the inhaler? The patient would have been trying to inhale without taking off the cap. Sounds really, really obvious. But these are some of the things that as a pharmacist, you need to explore. How are you using your inhaler? When you use it, what happens? Some people say nothing happens. And then you say, well, show me how it works. And then they will show you, and you see immediately what the issue is. I've had a patient where the inhaler is all clogged up with the white powder and says it's not working, it's faulty. And all I answer, have you rinsed it? Yes, I've rinsed it. It's all, yeah, I've done it. It doesn't work. So I've actually taken the inhaler off the patient, and I've taken it and rinsed it under the tap in front of the patient properly. And then the inhaler works. And the patient says, oh, I didn't know that's what I was supposed to do. But it's the same patient that has actually said to me, yes, I've rinsed it. So you need to really learn to put yourself in the patient's shoes. And don't forget as well that you know more about these medications than the patient. So nothing there should surprise you, but you learn something new every day. So, you know, what results are they getting when they use it? Some of them say it doesn't work. Some of them say it works. Some of them say, well, it only works for a little bit. Some of them, you know, the side effects are intolerable. I mean, I occasionally have used a salbutamol inhaler, and the tremor that I get from just 1 or 2 puffs of a salbutamol inhaler is really unpleasant. And I know it's going to happen for a few hours. But and I only use the inhaler maybe a couple of times a year. But imagine you're asking your patient to use this inhaler every day, twice a day, and they're going to get that tremor or thrush. You know, you need to be able to be empathetic in what you're doing. You need to also learn to try and see what it is that they're not doing right. So for example, some patients will keep actuating the inhaler 10 times. You know, they'll puff on the inhaler, and obviously that inhaler is not going to work. And you need to be able to explain to them that you need to wait at least 30 seconds between actuations for the hole to fill. I can't remember what the hole is called again, that the hole that holds the dose to fill before you press it again. So if you press it continuously, you're seeing a puff, but that puff is actually a propellant without any medication in. So it could be something as simple as that is making the medication not work and run out very quickly. You also need to start thinking, well, what is stopping these patients from taking these respiratory medications right? So it could be as simple as they don't have enough strength to press the inhaler, so you need an inhaler aid, and they don't have enough, you know, whoosh to actually activate the powder from the device. It might be that they don't have enough cognition to even know what to do. So it could be something like that. It could be a child who he just can't coordinate what he's doing. But what is it that is stopping them from doing it right? And what can you do about it? What other aids can you suggest? And this is another question you need to ask yourself. Number 7 is, what do they want? Do they want quality of life, or do they want quantity of life? Now, that's a really strange question, you might think. But some patients, for example, they're smokers. They might say to, you know, and you know that if they stop smoking, their COPD will get better or their bronchitis will get better. But they say, you know what, I've been smoking for 50 years. It's my only pleasure in life. I'm therefore going to continue. So again, that is something that you need to bear in mind when you're doing counseling, that they just want quality rather than quantity of life, and that is their choice. So understanding what is going on with the patient will determine what it is that you're going to advise. So the other thing is, I try to mix that slide with this one and the next one, but it's a bit difficult because it's like I needed to go forwards and backwards, but this is how I've done it. So when you're looking after your respiratory patients, you also need to think about the signs and the symptoms. So the signs are the things that you can see, and the symptoms are things that you can't see, but you can definitely measure. So that's how I've always tried to remember that a sign I can see. So if the patient's got blue fingers and blue lips, that's a sign. And the symptom might be they might be hypoxic. Their oxygen levels might be low. So that's how I try and remember it. But obviously, you guys might be remembering it in a different way. So the patient's signs or symptoms, it might be the thing that they're most worried about, not necessarily what you're worried. You might be worried about their oxygen saturation levels, but really that doesn't mean much to the patient, and it's the breathlessness and the coughing that they really just want to get rid of, or the sputum, or the fever, or the pain, or the sweat. So these are just the things that you need to be aware of. So if somebody's got a very high fever, yes, they have a respiratory problem, so offer them some antipyretics, some paracetamol. I know ibuprofen is controversial in patients that have got asthma, and you are going to read about that because I don't know what year you're in. But some patients may tell you that, it's the ibuprofen or non-steroidal that actually works better for me. And if their symptoms are not aggravated by that, then that is okay for them, provided you have explained to them what the risks are, because again, it's about quality rather than quantity of life. So it's not 100% true that somebody who's got a respiratory problem can have a non-steroidal. But obviously paracetamol is our first choice. Somebody might have a really, really dry cough, and all they need is water. So as a pharmacist, you need to be mindful that you're looking at a holistic person. One of the first things you should ask is how much water they drank. And they say, oh, I drink loads. Of course I drink loads. And then you say, oh, they do drink loads. So if a patient tells me, I drink loads of water, I'm always drinking, I drink like a fish, I said, okay, so just give me a typical example. So this morning, how much did you drink? How many cups did you drink? I said, oh, well, I had half a coffee. All right, fine. And then around lunchtime, what did you drink? Or tea time? And then you'll actually find that the patient who's had loads of has only had actually about 250 mils of water. So then you need to give them a solution. You need to say, you know what, in the morning when you get up, I want you to have a full glass of water. And then around 10 o'clock, I want you to have another full glass, 3 o'clock a full glass, 6 o'clock a full glass. If you give a patient specific instructions like that, they're actually more likely to follow than to tell them drink a lot of water, because a lot of water might be half a glass to them. But if you're saying to them, you need a full glass, you need to be able to have enough fluid in you to emulsify or to thin out those secretions, they will be able to understand that better. So each symptom and sign you need to look at and treat accordingly, or offer advice accordingly. On this slide, I just wanted to talk about some of the signs and symptoms that you may need to understand, or the things that go with the respiratory that you then need to chase up or follow up or give advice on. So for example, somebody who's cyanose, their nails are blue, their lips are blue, they're quite cold. You might be busy telling them to use their inhaler, but actually, in addition to needing a little bit of oxygen, they might just be very, very cold. So you just offer them to keep warm, hot drinks, just to make sure that they are warm and well fed, and really moisturized so the skin doesn't crack and so on. So these are some of the things that you need to think about. Most patients with respiratory problems, they tend to suffer from panic attacks and hyperventilation, because they're, some of them are effectively drowning in secretions, and they panic a lot, especially the elderly. and parents of small children. So in front of you could be a mother or father or other parent who is literally panicking and is in more stress than the child in front of them, or the elderly person is just absolutely petrified. So, you know, you may need to refer them for psychiatric help, social work help, and so on, or just to reassure the parent that actually this situation can be managed like this. A lot of patients with these respiratory problems, unfortunately, they live with animals in the house. So dogs and cats are not very unusual with these patients. So again, you need to talk about that subject. You may have to even suggest to get rid of the pet, which won't go down very well, but it is something that you have to put that subject out there on the table, or maybe when the child is more ill, they then don't have access to the pet. You know, so try and ask, do they have a cat or a rabbit or whatever animal that sheds hair in the home? If necessary, they may have to get, you know, a vacuum cleaner that is very high standard. Now, patients will get very offended when you mention this. So you need to learn to have a rapport with the patients and explain to them what's going on. When you're looking after respiratory problem patients, you also need to think about the underlying diseases like depression, weight. So some of them are very obese, and some of them are very, very emaciated. And some of them are very dehydrated. A lot of them are very dehydrated. So you need to also think about all those conditions. Some of them may need home oxygen, which then will need further assessment or referral. So in terms of drugs and challenges, that was another question that Philippa sent to me. Obviously, you will know about the drugs. I didn't want to tell you about each particular drug, but technically they fall into these broad groups. So either your bronchodilators, muscle relaxants, your steroids, antibiotics, and obviously oxygen. Obviously, there's also like physio involved in terms of management. Now, the challenges, especially with the bronchodilators and devices that deliver these bronchodilators, is that these can be very complicated devices, even for us pharmacists. I remember having to, I think it's Spiriva Respiva or Respimat. I found it very complicated to put together. Now, here's me giving it to this 75-year-old elderly person who's never seen it before, and they have to use it. Sometimes they'll take it home and just not even touch it because it's too complicated. So I think the devices are really, really complicated at the moment. And you as a pharmacist need to be familiar with how each particular device works. And so, for example, the round one, which is the Seretide, the Acuhaler, for example, which is a round disc. It's got powder in each of those blisters. So there's 60, a disc with 60 blisters, but it's inside the whole round thing. And the instructions, I'm sure when you're in your pharmacy, it says take 2 puffs twice a day. And actually that is wrong information for that particular device, because the patient will pop the blister and take 1 puff, and then pop another blister and take 1 puff. So automatically the patient's overdosed on that device. However, they may not even have taken enough dose. So the right instruction is when you pop the blister, you need to take maybe 4 or 5 puffs out of each 1 pop, so that you can actually empty the entire device. And there are very few pharmacists who actually know that information. So the patient will, if your patient is coming to you every 2 weeks for a new Acuhaler, you know they're using it wrong. So they might not necessarily tell you they're using it wrong, but they're definitely using it incorrectly. So these are some of the complicated devices that the patients use. Something that also looks really simple, like the spacer or the aero chamber that parents use with their kids. It's also quite complicated because if you tip it in the wrong way, you actually can't deliver the drug. Or if you puff too hard on it, you actually can't deliver the drug. If you wash it and you dry it with your towel, you cause too much static in it, and the drug sticks to the chamber rather than actually going into the patient. So all those things you need to be very aware of as the pharmacist. Steroids. Steroids are very complicated, as you know or will know as you do your lectures. So obviously you get lots of infection steroids, you get psychosis with steroids, you get weight gain with steroids, you get dependency with steroids, fluid retention, and bone loss as well with steroids. So those are nasty, but sometimes your patient may be dependent on these steroids and you need to persuade them that it's not necessary. I think half the battle we have now, or we have seen over the decades, is trying to wean people off steroids, because in the years gone by, everybody who so much has had a little cough, they would just put on prednisolone. So a lot of patients are dependent on prednisolone because of that. And obviously they can't sleep either. And then you give them Zopiclone or something else that helps them sleep, then they get hooked on the Zopiclone, then the Zopiclone doesn't work, and they get more stressed, and the steroids, you have to up the steroids, and then you keep going round like this. So this is something that you as a pharmacist need to be aware of. The other medications that you need to be, we use in respiratory, obviously, are antibiotics, a lot of antibiotics. It's very interesting that I was looking at this pharmacy first scheme, where the pharmacists can prescribe in their shops, and antibiotics for respiratory are not on there. That's really interesting. And also maybe a salbutamol inhaler is not on there. And I'm thinking, well, in the mainstay of respiratory, maybe those are the two things that might or should be on that list. I'm sure this is a bigger problem than impetigo or something like that. Oxygen is something else that you need to familiarize yourself with as a pharmacist. This is a very dangerous drug that is prescribed in some instances, and the patients have to use it either short, like intermittent, or they use it at home. Now, a lot of these patients on oxygen are smokers, which doesn't seem to go well with oxygen. Some of them end up on end-stage respiratory disease. Some of them have mobility issues. Some of them need carers, and so on. I remember when I was a pre-reg, I went out to the community and I met a patient who was on home oxygen, or who had been using home oxygen, and he was a smoker. And he lived in a little cul-de-sac, the one you drive in and only one car can drive out. So he lived right at the end of that cul-de-sac. And basically, he thought he could sneak some cigarettes in, and his house burned down. But because he lived at the end of the cul-de-sac, even the fire engine, and everybody was parked on the little, that little road. So the fire engine couldn't even go to the house. So the fire engine came, parked up at the top of the cul-de-sac, and they all just watched this house burn down. But the patient was essentially smoking and on oxygen. So you would think that somebody who's on oxygen would think, I shouldn't really be smoking. The other case I remember was, I was working at one of the hospitals in Manchester. The patient came in, hooked up with the oxygen mask. So he decided to go to the toilets to have a cigarette. So he's hooked up on the oxygen tank, and he actually lit up a cigarette, and his whole face burnt. But the worst thing was, because he was in the toilets hiding, nobody found him for quite some time. I mean, it was funny because he had this huge, like, red shape, but I think that was the last time he actually lit a cigarette with the oxygen tank hooked up on his face. So this is something that is real. I have actually seen it in my lifetime, that it can happen. Or you get a carer coming in, looking after a patient who's on home oxygen, and they go and have a cigarette. and they haven't thought about it. So the patient might not have a cigarette, but the carer does, or their relatives come to visit and they have a cigarette. So this is a lot of care around the oxygen that you need to think about. I don't think oxygen is now supplied in the community, but you need to be mindful of the fact that your patient may be on home oxygen. I don't know if I was going to mention, oh yeah, nebulizers. I'll mention at the next slide. I don't know how much more time I've got left, or not a lot. There was a question about using OTC medications. In terms of this area, I think the choice is really, really limited now. I don't understand why. I think it's ridiculous, but I'm coming to the end of my career and you guys are coming in. Practically, the patients now don't have any OTC remedies. So what they're doing in reality is they're buying the adult preparations and giving them to their kids. So maybe this is space for you to do some research on and, and take it forward. So there's no point removing, I don't know, Folcodine Linctus for kids from the shelves, which was the right strength. And then obviously Folcodine is slightly different now. I think that's also coming off. But the adult would just buy Folcodine. I actually visited one of my friends once, and their kids had a respiratory issue. They just grabbed the adult preparation they had bought, and they gave it to their 4-year-old. I was like, oh my goodness me. I said, well, it will work. Obviously, that was the parent making that decision for their child. So this is something that we need to really, really think about. That this parent will not let their child suffer and not give him anything. So I think we need to rethink that one. Yeah, I mentioned that no salbutamol inhalers are available over the counter. I find that really interesting. Water, you need to give practical advice, remove pets, etc. And obviously sleep. These patients can't sleep sometimes. In terms of resources, I think your BNF is your basic resource. Your Medicines and Ethics and Practice Guide is a fantastic guide that you shouldn't, I mean, I can't live without mine, even if I don't use it very often now, but in the beginning I really needed it. You need to familiarize yourself with spacers and aero chambers and how they work, You need to familiarize yourself with nebulizers because you do dispense the nebules. But just to be mindful that nebulizers are not funded on the NHS. They have never been funded and never will be funded on the NHS. So either the patient has to buy it privately, or the respiratory clinics usually give them away for free. What that means is that some pharmaceutical companies or some pharmaceutical companies donate these devices to the respiratory clinics, and then the respiratory clinic can give them away for free. Obviously, it works for the company because if I give you a free nebulizer, it means you're going to be using my drugs that are going to go in that machine. So it doesn't really, it's a charitable thing, but it's not really. But I had a look today at the nebulizers, and you can get one for about 40 pounds, which is really amazing because when I started out, there were, 200 pounds plus. So, but you need to impress on the patient that nebulizers are not available. The machines are not available on the NHS. Am I running out of time? I think I've got one more slide. Respiratory disease is pretty much an incurable disease. It impacts on practically the whole patient. So you need to look at the patient realistically and holistically. They won't be able to work, exercise, own a pet, the children will be falling behind in school. So you need to be really, really empathetic. You might need to refer to other services like mental health, cancer services, social services, chest clinic, welfare services, and even housing. So if you're smelling mold on your patient, this is for you to safeguard, raise a safeguard, and with the social service or safeguarding board, so that the patient can be found alternative accommodation, or somebody can help them with their housing, because there's no point giving them drugs when the mold is actually remains in the house. So, I mean, I had a whole load more questions, but I needed probably about 3 hours to cover those. So that is what I thought would fit into the 30 minutes. I hope that helps. Any questions?
Does anyone have any questions? If you want to add a bit more information, you can do, because unfortunately our last speaker is, like, as some of you guys know, who was here, like, he's having technical difficulties and he can't join at all. It's a loss, but it's okay, because we've had three other, like, great speakers who talked about some really good stuff. So does anyone have any more questions?
Very sunny where I am, so
It is a bit sunny today, like, it's been
very
bright.
sunny. Yeah, if anybody has any questions, I can try and answer. Nobody has.
No one ever has questions. He's like, anyway, we can wait and see for the next until 35. No one has any questions, then you can say much for joining, but you can leave your email as well. Like, can you please type your email in the chat? If anyone has any, and reach out to you and just
type. Okay, I'll type my email in. Oops. Maybe everybody's tired. Does anybody want to be a respiratory pharmacist, or why did they choose this topic?
Does somebody want to volunteer and, like, speak? Yeah. Guys, feel free, like, okay? Feel free, have a little bit. Okay. Some people don't have things anymore. Guys, we're nearly coming to the end, because
well, I have a reason. I did a case study on this topic like a couple weeks ago, and I found it really interesting. So I joined this webinar hoping to know more about this topic. And yeah, thank you for everything you said. I was able to make notes, and I'm going to take it along with me for future purposes. Yeah, thank you.
Oh, you're welcome. What was the case study? What was wrong with the patient?
It was a coursework that I had to write, and we had to discuss different types of inhalers, and we had to answer multiple questions. I just found it interesting, and yeah, that's why I'm here today. Thank you.
Okay, I mean, that's great. I mean, inhalers are more complicated now than they were when I first started. And it's actually very hard to use an inhaler. I don't know if you've ever tried.
No, I haven't tried it, no.
I think if you try, this is what I mean, like, if you're really going to be empathetic, you need to try and use an inhaler, because they do placebo inhalers that you can try, and this is how they use the placebo ones to teach the patients, and it will definitely make you a better pharmacist, more empathetic to your patients, because you can imagine this 4-year-old you're trying to coordinate is jumping up and down, and you're trying to ask them to use their inhaler, and it's not going to work.
Yeah.
Does anyone else have any more questions? Well, I don't think anyone has any questions. So thank you so much. Thank you very much for joining. And thank you for this beautiful talk that you have taken up with your day to be able to be here with us today. And I hope you have a great rest of your day.
Oh, thank you so much for inviting me, and I wish you all very well on your course. If anybody's got any problems, with your pharmacy course, give me a shout. I'd be quite happy to help out. All right, take care.
Take care. Thank you so much for
Take care.
joining.
All right. Bye-bye. Bye.
All right, guys. So I'm so sorry that our last speaker, who was meant to be here with us, he joined. I think some of you guys saw him join. Let me just do a little intro on what he was going to be talking about, so that if you guys have, you're more interested, like email him. And also, like, he has different stands. For example, how I got to know about him was at Clinical Congress in Manchester. So he had like a stand, and he was talking about like asthma, like inhalers, and the sort of I've forgotten the name of it, but when you pump it into like a thing and then you put it to the patient, and he was talking about that stuff and how you can use it, the benefits it has while patients. He was even going to do like a demonstration on how it works and stuff like that, and more about that type of thing. But unfortunately, like, he's unable to join because of the technical difficulties that he has. And I do apologize, guys. So sorry about that. If you're looking forward to having him here. But let me just share a little bit on an intro about him. And I'll leave his email down below as well. You can message him. So yeah, his name is Deval Sarah, and he's the market access manager at Scion Pharma. And obviously, he has an education background in pharmaceutical chemistry and pharmaceutical marketing, and he has experience for 14 years in the pharmaceutical industry. And also, so he was going to talk about spacer devices for inhaled therapy with PMDIs, and why HCPS should be recommended spacers / VHC with PMDIs. So unfortunately, guys, I'm so sorry. I was also looking forward to that. But you know what? We've had a great we've got our 3 speakers who've been so great as well. But yeah, a bit more of what he was going to be talking about. Oopsie, not going fast. So the disadvantages with only PMDIs, benefits using spacers, the different types of spacers, how materials and different features of spacers affect drug delivery, like a bit more of, you see the first speaker, what he was talking about, it's a bit more of that, like it was going to link well together. And then he was also going to show us and demonstrate how to use a dispenser, how to clean it, and drug delivery of different types of dispensers. Like, he has a bunch of different types of dispensers. But anyway, not to worry. I'm going to leave his email down below in the description. Like, he's got some really interesting things. And also, like, as I said, if you're more interested in this topic, you want to learn more, from how dispensers work and stuff like that, I'm going to leave his email down below. I'm going to leave his email down below, and yeah, and you guys can sort of message him and email him and just tell him a little bit more. So let me put it in the chat actually. And then before I'll do that to the end, let me wrap up this conference and we can finish a bit earlier. So we're finishing a little way more earlier than I expected. But yeah, that's it with our speaker. Unfortunately, he can't be here. I apologize on behalf of the speaker and on behalf of myself as well, that you guys, can't, be here to hear that talk. But furthermore, going on to the next slide, we've already had Rehma, like she's done speaking. She was talking about that side of pharmacy, and also like now I'm going to go on to like things that are upcoming competitions within the BPSA. And yeah, so basically we have an upcoming what's it called, climate change campaign. So obviously it is climate change month, like it's climate change month. So and also us as pharmacists, it's important to be, becoming greener for our environment, because there's a lot of like the greenhouse effect is really affecting the environment really badly. So it's just like, where's our future looking forward, like, what's the future looking like? So, so this poster is just like, create a poster, make it unique, make it stand out, because they are going to pick the winner, and make it stand out on, greener pharmacy, make it theme it with pharmacy and climate change, and just make it as bright as possible, beautiful colors, also the theme, why did you go with this, what does it mean to you? And yeah, that's a bit of the climate change campaign poster. So yeah, that's the competition poster, that the competition. And then I'm going to be talking about annual conference. So majority of you guys should know about annual conference. I wish I could get rid of this, you know? Yay! So this whole time was yeah. So yeah, 80 seconds. So annual conference, majority of you guys have probably heard about annual conference now because it's the hot topic. That's what everybody's talking about right now. BPSA pharmacy students, you know, annual conference, because like as I said, it's not far away, it's coming. It's going to be, I think, after next week. Like, whoa, March has finished so quickly. So annual conference is going to be on the 31st of March to the 7th of April. And it's going to be in Norwich this year at the University of East Anglia. And if you go University of East Anglia, or if you go in Norwich this year for annual conference, you will see me there. I will be there. So yeah, feel free to come and speak, you know, have a chat. I'm always down for a good chat any day. And also, if you guys are really interested in coming annual conference, but you haven't yet got your ticket, you can still like, I don't know, you can still press go on our Eventry. Tickets are still able to let me just walk you guys through the process. So there's still some tickets that you can still get. There's still the delegate package 1, the package 2, package 3, etc. So you know, go on more information if you want to know a little bit more about what each packet is. And then you know, yeah, that way you can find out more on what the package involves and stuff like that. There's also BPSA day ticket, and but all of these tickets are running out. That they're running low because obviously the event is literally nearly coming because 31st of March is not far away. Like as I said, it's after next week. So annual conference, if you don't know about it, like if you don't know about annual conference, I might do a little description of what annual conference is. So annual conference is, to put it in easier terms, is the BPSA's birthday. So how long the BPSA has been running for. This year it's going to be turning 82nd years, like 82nd years the BPSA has been running for. BPSA is a, you know, pharmacy majority pharmacy led society, you know, and you know, we are going to have awards nights, we're going to have ball nights, we're going to have so many opportunities of networking with different, you know, pharmacy students, different healthcare professionals, especially majority who are going to be pharmacists, different stands that are going to be there. So it's going to be a time to shine as well. Speak to sponsors, you know, lay yourself out there, let people, you know who you are, because I feel like there's power in networking. You make your network, like, basically. So, you know, and I feel like majority of you guys who are here, like, I do appreciate you guys taking this time out of your day. You could have gone and done other things, but the fact that you came and, you know, you were interested in this, I do appreciate you. So this is why I say, you know, when you make time for these, you go very far. Like, you know, you're putting yourself out there, you're letting people, you're making network. So yeah, and also making friends as well, because it's really important to make friends in the same area that you're in, like-minded friends. You know, you can advise one another, or even like there's so many different people with different levels of knowledge. You can educate one another when it comes to, you know, all of these topics to be able to bring, you know, give the best healthcare to patients as possible. But yeah, these are some of the things. Like this first picture here, I think it was culture night. There'll be so many different themes. Like there's going to be culture night. I think there's going to be like a Hollywood type of theme. So you have to just Hollywood like. There's going to be just a bunch of different things. But what's important is if you're really interested, do get tickets. But tickets are running low, so just, you know, to be aware of that. And yeah, so if you're going, you will see me at East Anglia. You will see me there. So if you're not going, hopefully one day we'll be able to meet one day, you know, networking somewhere, someone. You can always reach out to me as well if you wanna, you know, just talk, have a conversation. I will leave my LinkedIn below and my email as well. So you guys can reach out if you want to. Also, let me do my personal thank yous. So thank you guys. I want to thank you guys who've actually joined today. Every single one of you guys, I do appreciate you. Appreciate the time you've taken out your day, considering that you could have been doing other things. My speakers are obviously not here, but I do thank the speakers who have come to speak because they've not only educated you guys, but they've also educated myself. And I've left leaving with some knowledge that I didn't know before. And I want to thank exec members as well, like, Emma. Emma was really helpful. She came and helped me out when it came to setting up and stuff like that. And also my school of pharmacy, they are helpful when it comes to several stuff, like they try to help me find speakers and stuff like that. So yeah. Oh, reps and liaisons. I think I talked about my reps and liaisons. I don't remember, did I? Oh, reps and liaisons. I think I did, but let me repeat. I thank my reps and liaisons because they helped me pick a topic like respiratory. They helped me pick this topic to do the conference on. So feedback form. So if you guys can help me scan this feedback form, or actually let me leave the link. Actually, can one of you guys or can someone scan this feedback form and tell me if it's working or if it's not working? If it's not working, let me put the link in the chat box. But if it's working, then just scan it and let me know if it works. And then if you can see the Pennine area on it as well. I could read this the whole time. That's nice. Oh, okay, it works. Thank you, Cindy. Thank you. Thank you for letting me know, Selena. We're almost done anyway. So if you need to go, don't worry about it. Thank you so much for joining. So yeah, can everybody leave all your emails down below? And also if you're here from last year, and I still need to send your tickets, certificates. So I'm doing all of that. I'll try to get it done today because get it out of the way and let you know it's done. But can everybody who's joined just send your email just in case? And oh, feedback form. I'm literally blocking it. But yeah, can you please, if you have any feedback to give me, and you can add any more feedback. If you want to stay for a chat, I'm gonna end the recording because we're pretty much done. Let me end it by saying thank you. So thank you guys, as I said, for taking your time out. The recording. Yeah, thank you so much for taking your time out. As I said, I do appreciate you guys. And